Hello, and we'd like to welcome everyone to the Green Bag Lunch Green Tea webinar series. We'll get started in a couple minutes, or just give people one more minute to log on here. I see some people are adding as we speak. So we will get started in a minute here. Just want to make sure we give people some time to log on. Okay, we're probably going to get started, and as people add, they will. They can just jump in as we are. So again, just a few housekeeping things to take care of before we begin. This webinar platform works best on Chrome. If you're having any technical difficulties, the first thing to do would be to close out your browser, close out all the extra windows that you may have open, and restart the computer, then log in again. This webinar series has 7 parts to it. We'd love for you to invite colleagues for any of the upcoming subjects we plan to offer on the first Monday of every month, excluding when it lands on a holiday. And we will be posting live recordings on the Annie website. Apologies for not getting the first one up there by now, but we'll be getting that posted in the next week. If you have any questions for presenters, you can record those in the chat room area to the left side of your screen under attendee chat. And we'll allow some time after the presentations to answer any of those questions that you might have. Lastly, in order to receive the CE certificate, you'll need to complete the presentation evaluation. That will be emailed to you just after the presentation, and it would be in the form of a Google form, and that way you'll be able to access your CE certificate. Okay, we have very happy to present Jay Feldman today. He's the Executive Director of the National Environmental and Public Health Group Beyond Pesticides, which has a 38-year history of working with communities nationwide on toxics and organic policies in agricultural and land management practices that maintain ecological balance, biodiversity, and avoid reliance on toxic chemicals. In 2010, he was appointed by the Obama administration to a 5-year appointment of the National Organic Standards Board, a stakeholder board that advises on organic and determines allowable materials. He currently serves on the executive board of the National Organic Coalition. He launched an effort to take pesticides out of hospitals with the publication of Healthy Hospitals from 2003, and then successfully implemented non-toxic management strategies at hospitals in the Baltimore area, including Johns Hopkins Bayview and Howard County and the University of Maryland Medical Center. Jay has dedicated his life to working with local people and community groups to empower and support action where government and chemical companies fail to provide adequate protection of health and the environment. So without further ado, Jay Feldman.
Thank you so much. It's an honor to be here with you guys today. I wanted to just give you a context in which we work on this issue. Obviously, we're concerned about chemical exposures, and we'll talk about the processes that govern determinations of what's on our food and how chemicals are used. But we'll also look at issues around policy, the governing statutes that affect how those processes work. Our inspiration really comes from Rachel Carson, who really asked us to think holistically about how and why we're using toxic chemicals, particularly pesticides. But the interesting thing about her writings is that because she was based in or rooted in this scientific understanding of biological systems, she looked holistically at the environment. That's sort of what I would like to try to do today in terms of this discussion. One of the things that in reading Silent Spring that I think is important to really delve into when we're talking about pesticides is that we're putting toxic chemicals into the environment purposefully in the context of complex biological systems. And that's true whether we're talking about the environment in which the chemicals are used, say on a farm. I mean, that's a complex biological community with soil organisms. We're talking about beneficial fungi, beneficial bacteria. We're talking about a range of animals that are essential to cycling nutrients in the soil. And we sort of ignore that in the context of modern agriculture or chemical intensive agriculture because we think that we can break down the important nutrients in soil and feed that in the form of synthetic ingredients, nitrogen, phosphorus, potassium, to plants. And because we believe we can do that, we can be reductionist in identifying those nutrients. We allow ourselves the ability to use toxic chemicals. We fertilize the soils with synthetics. We kill off the natural environment necessary to cycle nutrients for the plants. So then we add those synthetic fertilizers in, and we add the pesticides into that context. The other thing Rachel Carson taught us about was the fact that, and this is way back, right? In the 60s, she was telling us that there were alternative methods. And that's sort of where I come down on this. And I sort of have spent a lot of time sort of cultivating public understanding about the alternatives. When we talk about pesticides, and you've all seen a pesticide in a can of Raid, you've seen an exterminator come into a building, they're applying pesticides. They're actually applying formulations of chemicals. If you look at a product label, you'll see active ingredient and inert ingredient. Now they're calling this other ingredients. You won't see any mention of contaminants, impurities, or metabolites. But these are all elements of that formulation that can have an adverse impact. So the active ingredients are the materials or the synthetics that are typically in a pesticide that attack the target pest. That's pretty clear. And if you look at the label, you'll see usually a very small percentage of that overall product is actually the active ingredient. The bulk of the product is really typically the inert ingredients. And these are considered proprietary information. They're not disclosed on the product label. The public cannot get access to this information. And we know that they include toxic chemicals often, not always, but these are chemicals that make up the solution, the dust, the granule, in which the carrier become the carrier for the active ingredient. They can also increase through synergistic effects, the efficacy of the product. They can make the product be more easily absorbed into the plant material. And so it raises a lot of questions as to what we're being exposed to. If you're in a medical scenario and you have a patient who you think has been exposed and is expressing symptoms of a pesticide poisoning, you can get access through the manufacturer to the inert ingredients under a confidentiality agreement. But that's really the only condition under which we, the public, can get access to this information. In addition to the inert ingredients are the contaminants. And, you know, the contaminants can be something like DDT, for instance. DDT is a contaminant in an insecticide. But typically it's a bunch of materials that are mixed together often we don't know all the contaminants that are in there. Pentachlorophenol is a great example, creosote. Dioxin pops up over and over again as a contaminant. Different forms of dioxins, as you may know. And then metabolites, the breakdown products. What happens to this chemical material when it's exposed to sunlight, when it oxidizes, when there are different conditions that cause that material to break down? And so we can take a chemical like malathion, an organophosphate, it breaks down to meloxin, which is more toxic than the parent compound. So when we look at pesticides and we try to catalog their adverse effects, these are the kinds of adverse impacts that EPA is looking at. And they're requiring testing by the manufacturer based on EPA protocol. The manufacturer produces the test. These are typically laboratory animal tests, and presents that data to the EPA. EPA then is supposed to evaluate those findings and make a determination as to whether the proposed label from the manufacturer provides adequate protection. Now, you might say, well, why are we registering carcinogens or endocrine disruptors or reproductive toxicants or neurotoxic materials? And the fact is, these materials, by virtue of policy, have been determined to have social value, and therefore the process that EPA utilizes to determine use patterns is based on an acceptable level of risk, a determination of acceptable level of risk. So yes, there are carcinogens in our food, but EPA has made a determination that the risks associated with that exposure is acceptable. And we're going to discuss that in more detail. Similarly, with environmental impacts, groundwater contamination, we've read a lot about toxicity to bees and the impact on pollinators. And I think that's one of the better examples of the failure of the regulatory process to adequately consider these complex biological communities that Rachel Carson talked about. And of course, when you see the impact on bees, you clearly can identify with the fact that there's a whole chain of events that may occur as a result of affecting or adversely affecting a species. And so you may have read about the insect apocalypse that has been cataloged by numerous studies in which we've seen a 90% reduction in the last 27 years of the monarch butterfly. These are all really symptomatic of limitations of our regulatory system. But, in effect, we can't survive, obviously, without a robust insect population in this world. And so this is what we see. We see deformities as a result of exposure in the environment. Now, this is probably an endocrine disrupting effect. The difficulty here is that we're not testing for endocrine disrupting effects in the United States. A law was passed back in 1996, the Food Quality Protection Act, that required testing for endocrine disruption. EPA missed virtually every deadline, never was able to get this program up and running. So we continue to basically use endocrine disruptors for food production, for management of turf and playing fields and parks. And that provides a critical challenge because we don't have all the information we need for that particular toxic endpoint. And now we're seeing epigenetic effects or multi-generational effects, impacts on DNA that, again, EPA is not equipped to evaluate. Going back to that list I mentioned and had up on the screen earlier for reproductive effects, cancer effects, neurological effects, the protocols that EPA require are pretty limited in terms of these complexities. And then we already talked about the impact on pollinators and insect species that we rely on in the environment. So our position is that we need to start through this regulatory process to protect pollinators as a keystone species and as a way of understanding our interaction with the environment and how we grow food. Soil is the beginning point for all of this. If we ignore the soil, then we effectively create a pesticide treadmill because we don't honor the relationship of the ecosystem and the biology, the soil biology that's so important to that ecosystem. We decided many years ago, actually, to develop a pesticide-induced diseases database, looking at the epidemiologic studies that are out there in the literature. This is something EPA doesn't look at. It's certainly not on a regular basis factored into the EPA decision on registering a pesticide. And it really wasn't difficult to come up with these endpoints and find these patterns in the scientific literature. It's something that's worth looking at as a practitioner, I think, to understand that the connection between these exposure patterns and some of the chronic diseases that we're seeing more commonly. And I'll leave it at that for now. But just breaking this down, the cancer studies have zeroed in on specific health outcomes. Non-Hodgkin's lymphoma shows up as associated with exposure, breast cancer as well. And specific use patterns are occurring as a result of that result in these exposures. Same with Parkinson's, clear studies. This one looked at oxidative stress, which is thought to play an important role in neurotoxicity. Then there's the reproductive dysfunction. Again, we're seeing this dramatic decline in sperm concentration, and that's been repeated. The results here have been repeated. We're also seeing, and this again is real world data, sometimes the contaminated source, say a water source, would be brought into a laboratory, or a real world exposure scenario would be replicated in a laboratory. And we're seeing effects at levels or below levels that are determined by EPA to be acceptable. And you've read about glyphosate or Roundup in the news. This is, again, a situation in which the regulatory system has not captured the full range of the data. So you see this discrepancy both with looking at the active ingredient and full formulations. That's one thing that the World Health Organization did and the International Agency for Research on Cancer. And also looking at human exposures, which EPA does not look at. And so this is in the news. Europe is regulating it, banning it. Meanwhile, our regulatory system in the US seems to be defending its use. So at least that's what the people in positions of authority are saying right now. Similarly, the neonicotinoids, are a family of chemicals that are very persistent, and these are chemicals that have been associated with the colony collapse, or this colony collapse relating to the pollinators, but huge declines in the populations of pollinators. And there's a lot of data increasingly on these neonicotinoids. Again, concentrations that are found in streams and rivers and lakes. And now we're seeing this in drinking water, and there's concern about human health effects as well. So this is not just, and usually it's the case where we don't just see an effect in animals that don't translate at some point to the human population. Again, neonicotinoids, imidacloprid here in this particular study is the most widely used pesticide. If you're managing a turf in a context of a school or a yard or a home, I would bet that imidacloprid is being used in that environment. And again, we're seeing organisms, increasingly wide variety of organisms being affected by that exposure. going to pass over this one. And again, I mentioned earlier this insect apocalypse. Same thing with the aquatic food web. There are trophic effects here. So we are starting at the keystone species at the bottom of the slide where, you're seeing some, organisms really deep at the benthic level of aquatic system. But you can see how moving up that chain, there are effects. And to the extent that we're not adequately studying these keystone species, we have a human health issue ultimately at the top of this food web. Atrazine is the chemical, a triazine family that is associated with those endocrine disrupting reproductive effects. Again, if you look at real world levels as opposed to the studies EPAs are looking at, we're seeing levels of concern that are exceeded by as much as 200-fold for some organisms. And that's at real world exposures under EPA standards. Then, of course, there are vulnerable population groups. And the American Academy of Pediatrics jumped into this whole issue 7 years ago now and has a number of position papers on this. Importantly, they found that epidemiologic evidence demonstrates associations between early life exposure to pesticides and pediatric cancers, decreased cognitive function, and behavioral problems. And this is where we're seeing increased association with autism and the autism spectrum, and pesticide exposure, which is increasingly problematic. Increasingly, we're seeing through the USGS, U.S. Geological Survey, impacts on wildlife and in waterways, which again affects ultimately human health as well. So we're talking about a law that most people have never heard of in this context of Federal Insecticide, Fungicide, and Rodenticide Act. And it's, in many ways, it's a risk-benefit law, in which the agency is really not looking at whether we need a chemical, but it's looking at whether they can create a so what level of exposure, or a level of exposure in which the exposure patterns result in what the agency determines is an acceptable level of harm. And that's based on a risk assessment scenario in which the agency is conducting risk assessments, but by nature of the risk assessment, missing a whole bunch of factors. We don't look at mixtures, we don't look at synergy, we're not looking at full formulation, so we don't catch the inert ingredients and metabolites of contaminants. Certain endpoints are not evaluated, like endocrine disruption. And we're looking, for the most part, at 100% compliance, meaning that we assume when we do a risk assessment that there aren't accidents, that we assume they follow the label 100% of the time. And so we have arbitrary exposure assumptions, not real world exposure assumptions. We're not monitoring. And when we do all this, the agency, EPA in this case, attaches an additional margin of safety. But even if you apply a 100-fold or 10-fold margin of safety, it's still 10 times zero. I mean, we don't know some of these endpoints, and therefore that margin of safety is not going to help us, especially because with endocrine disruptors, we're not talking about classical toxicology where dose makes the poison. We're looking at minute doses of exposure during critical windows of vulnerability, and that is not helped by a 10-fold or 100-fold margin of safety. So when we look at uncertainties, the question for us is, I think, should be, as policymakers or certainly as decision makers, what are we going to use in hospitals to manage pests? How are we going to manage the turf or the lawn or the landscape around the hospital or our homes? We really should be looking at a precautionary approach to these things. Relying on the risk assessment numbers that come out based on not having addressed these complexities really leaves us in the dark on these questions. So I'm going to run through these quickly. Just know that there are numerous studies that make these issues real. I mean, these are not theoretical. I'm not just saying there's missing data and therefore we should have the data. I'm basically saying that there are studies that confirm that this missing data has impact, that not studying these interactions means that we're missing a whole bunch of endpoints, and studies prove that on specific chemicals. Synergy considerations present a source of uncertainty that might be germane, I would say is germane to. Now we're switching to what are we growing and what are we eating? And certainly we're eating, unless we're eating organic food, we're certainly eating genetically engineered crops, which have become more and more reliant on pesticide use, which is problematic, obviously. So there are pesticides in our foods. They're determined by acceptable residues. I'll return to the complexities that Rachel Carson raised, because if we're looking at a chemical like glyphosate, glyphosate was actually developed as an antibiotic. So it has antibiotic properties and therefore destructive of beneficial microbiota in the human gut. Now, glyphosate is showing up in virtually all our food. So think about it. We're exposed to this whether we're having a glass of beer or we're eating bread or feeding our kids Cheerios or breakfast cereals. Glyphosate is in that food. And a lot of scientists are now looking at 21st century diseases, all the ones I listed at the beginning, or at least in the pesticide-induced diseases database: diabetes, obesity, heart disease, antibiotic. Okay, so then we move into antibiotic resistance issues, because we're using antibiotics in row crops and orchard crops, and we are creating a resistance problem, which the World Health Organization has identified as one of the leading cutting edge problems of disease and illness into the future, as we lose antibiotics for medical purposes. And the fact is, having that use in our food production becomes problematic over time. So, even if you delve into the literature and EPA, you'll find that at the bottom of this slide, EPA concludes that there is sufficient evidence that there are neurodevelopmental effects occurring. And that is one of the issues that we're seeing over and over again. So I have just lost the slides. I don't know why. But what I was going to end on here, oh, here we go. Thank you. You can listen to a presentation like this and think, wow, what are we going to do? I mean, pesticides are integral to food production, integral to landscape management, playing fields. You can talk to parks directors in the towns we live in, and they'll say you can't manage a playing field without these toxic chemicals. Just as many farmers will say we can't grow food without this. Well, the fact is we can, and organic has shown us that we can do that. We can talk more about that. In addition to that, our food production methods have a tremendous impact on these larger critical public health issues that go to the climate crisis, the insect apocalypse, and a whole bunch of issues around water pollution, clean water, clean air, worker protection. I find this study just incredibly fascinating, because all the theories of dependency and the need for chemicals in conventional or chemical intensive agriculture blown out of the water when you look at organic systems. Whether we're talking about nutritional quality or yield or soil quality, minimization of energy inputs, biodiversity, profitability from a farm perspective, total cost ecosystem services, obviously worker exposure, and ultimately minimizing pesticide residues in our food. So we have an opportunity here to really make a difference with our food choices, with influencing policy on how food is grown. It has a direct impact on not only the complexity of the ecosystem which we rely on, but ultimately human health. So with that, I will leave you with my contact information. Happy to discuss this and develop campaigns around how hospitals are using pesticides, as well as how these chemicals are being used in our communities. Thank you.
Thank you, Jay. That was very, very informative. Next up, we'd like to introduce Dr. Alexa Curtis. She is Associate Professor and Director of Nurse Practitioner Programs at the University of San Francisco School of Nursing and Health Professions. She's a content expert in rural health with a particular focus on vulnerable populations. She teaches applied epidemiology and data analysis and advanced assessment and health promotion in the Doctor of Nursing Practice program within the USF School of Nursing and Health Professions program. So I'd like to invite Alexa to begin her presentation.
Hi, thank you. Thanks for having me today. So as the introduction stated, I am the director of the nurse practitioner program at University of San Francisco. I am a family nurse practitioner, and I come to you today to speak from a nursing clinician perspective and how I have worked through some of these issues of insecticides, and in the frame of how do I speak to the patients that I work with, my friends, family, community members, in a professional clinician, from a professional clinician perspective, as well as an advocacy perspective. So to give you some context, I practice up in Nevada County, California. It's a mixed community of agriculture and forest land. And so I am a family nurse practitioner, and my husband is a pediatrician. So these pesticides conversations are ones that do come up in our community. And this is where Nevada County is situated. It's that red county right there in the California map. It's on the southernmost end of the Congressional District 1 in California. So as you can see, that extends way up to the Oregon border. And a lot of my district, not only my local community, but my district is agricultural. So to give you a little bit of a sociocultural context of my own lived existence, my own sons in the upper left-hand corner there are farmers. They run a organic, small-scale, attempting to be sustainable farm in District 1. Called the Flying V Farm. My other son was an environmental studies major at UC Santa Barbara and is actually now engaged in the University of San Francisco Environmental Management program. So these are conversations that we have very close at home. And to balance that out, my life in District 1, District 1 is by voting block, historically conservative. And I do have close relationships with our elected representatives. On the left, I'm there with one of my nurse practitioner students, meeting with, he's now California Senator Brian Daley. He himself is a seed farmer in District 1. And then on the right is U.S. Congressman Doug LaMalfa, and he is with my daughter, who was an intern in the District 1 office as an undergraduate communications major, and then proceeded into an internship in the U.S. Department of Agriculture. She was a 4-H FFA girl. So I know these two, and he is, Congressman LaMalfa is a rice farmer. So I know these two gentlemen very well, reasonably well, and they are not organic farmers. And I don't know, so I don't know exactly which product they use on their crops. I do know that Senator Daley started to engage me in a conversation of glyphosate, of which I was not prepared to have. I was there talking about nurse practitioner scope of practice, which, by the way, both of them have been very supportive of the role of nursing in improving health outcomes in District 1. So how did I come to have an interest in insecticides? Beyond being a rural health provider, most of my work, though, has been around access to care issues for vulnerable populations, particularly under-resourced and at-risk youth. So, but certainly in my work, in terms of worker safety, I have studied and have been involved in occupational health issues of farm workers. But in 2017, I was either listening to the news in my car or saw in passing this headline that the EPA Administrator Pruitt denies petition to ban widely used pesticide. So that caught my eye and made me wonder, as a practitioner, a clinician, and a citizen, well, why? And how will I, since it was such a widely distributed news feature, how will I address this in my clinical practice? So from there, I decided to do a bit of a deep dive into this decision and Chlorpyrifos regulation. And I had the great opportunity to do this deep dive with Dr. Barbara Sattler, after which we produced a manuscript for the Journal of the American Association of Nurse Practitioners with the frame of, okay, let's look at this as nurses and community members, and what can we bring back to our practice? So what I learned is Chlorpyrifos is an organophosphate insecticide that's been around since 1965, and it's one of the most widely used insecticides on the market. I learned that it is predominantly used on produce and feed crops. By pound, the largest application is corn and soybeans. This I've actually found pretty interesting because I have an aunt in Pennsylvania. She's actually the head, or was the head, of a migrant education program and lives in Lancaster around soybean fields, and a very informed person. And I said, Jane, what do you think about Chlorpyrifos? And she said, what is Chlorpyrifos? And I thought, well, that's interesting, because if Jane doesn't know what Chlorpyrifos is, I think a fair amount of my patients might not know what Chlorpyrifos is also. And then it's used on a variety of other crops. The highest concentration of use of Chlorpyrifos in the United States is in California, Pennsylvania, and Georgia. So then I proceeded to try to look at, so where are people exposed to insecticides? So this is all insecticides, not strictly Chlorpyrifos. And this is a slide from the Centers for Disease Control. So you can see, yes, indeed, California, Pennsylvania, Georgia, the population there have increased exposure to insecticides, as well as several other states in the United States. So then I wanted to know, if a patient, family member, community member asks me what Chlorpyrifos does, I want to know, well, what does this do? How can I explain this to my patients? So at toxic doses, what Chlorpyrifos does is it causes an excessive accumulation of acetylcholine in the neurosynapses. And what that does is it results in cholinergic overstimulation within the central and peripheral nervous systems. So a very unfortunate example of a high-level toxic dose of this organophosphate would be the sarin gas attack. So this chemical can be used in chemical warfare. But really, we're not talking about, when we're talking about to our patients about Chlorpyrifos exposure, we're not talking about the large toxic overdoses, what the regulation is concerned about is the subacute environmental organophosphate exposure, particularly from agricultural insecticide use. So then my next step was to say, well, what do we think we might know about this chronic chlorpyrifos exposure? What can I relate to my patients? And some of the things that are of concern are neuropsychological function, including memory, mood, attention, psychomotor coordination, and sleep. And this is for the chronic exposure of the farm worker, as well as an increased risk for children under 2, as well as prenatal risk for pregnant women. We have some concern about the fetal brain development. There's, as Jay was talking about, there's concern about the possibility of endocrine disruption. The cancer risk, and I will certainly rely back to Jay as the toxicologist and maybe in the question and answer period, and he can help explain some of these areas more. But in looking at the cancer risk, there didn't seem to be as clear of a concern for cancer, but it is certainly there. So beyond human concerns, I wanted to be able to talk to my patients about the larger environmental impact of chlorpyrifos. And what I learned is that it's classified as toxic to fish and birds, but the actual kill risk with the approved use is very small. Now, point well taken by Jay that a lot of times we're talking about the approved use. So what we know is that the actual use does not always match the approved use. And again, I'll go back to my farmer boys. Before they started their own farm, they worked on other farms up in Northern California, and they will tell you that they witnessed unapproved use of these chemicals in ways that made them concerned, particularly for farm worker safety. And then it is considered highly toxic to honeybees. And again, the risk can be mitigated with careful application, but that is, once again, depending on the applicator. So I wanted to then really dig into, okay, well, why was there this policy shift? Beyond, so what I understand in my world in District 1 is that all my community members in District 1 care about their community. They care about the land. They care about their families. And whether we're talking to the organic farm worker community that my family is surrounded around, or the more conventional farming community that is represented by our elected officials, all these people care about the community. So why would there be such a flip-flop in a decision around chlorpyrifos? So I started to look into the EPA decision and what studies did they use to make their determination on chlorpyrifos. And so what I learned is that the analysis of the association between neurodevelopmental disorders in children relied heavily on 3 prospective birth cohort studies: the mothers and newborn study of North Manhattan and South Bronx, conducted by the Center for Children's Environmental Health at Columbia, the Mount Sinai Children's Environmental Health Study, and the Center for Health Assessment of Mothers and Children of Salinas Valley, the Chamacos Study. The risk assessments that the EPA was using did rely heavily on the Columbia study, Center for Children's Environmental Health. So starting there, what did the Columbia Center for Children's Environmental Health study find? They sampled children born of African American and Dominican descent beginning in 1998, and these children had heavy exposure to indoor chlorpyrifos, bug spray, cat roaches. This was an urban cockroaches. This was an urban sample. And then what they looked at was at 36 months, they found cognitive and psychomotor delays, statistically significant cognitive psychomotor delays, attention problems, symptoms of pervasive developmental disorder. So differences between exposure samples, the high exposure and the non or low exposure. There was statistically significant differences between those samples. This is not particularly talking about effect size or clinical implications of these changes, but there is a difference in the samples of exposure. And they looked at later childhood, and they found declines in memory, IQ, and motor development, and some morphological changes in the brain, that particularly the areas that center around memory and behavior. So the next study that they examined, and I'm going to go back. There's a reason I have some of these words in red, and let me go through these first, and then I will go back. So then the next study was the Mount Sinai Children's Environmental Health Study, and it examined effects of prenatal exposure on multi-ethnic, again, were inner city kids born between 1998 and 2002. What they found was at 24 months, CPF exposure was inversely related to performance on the Mental Development Index. They saw slight decreases in full-scale IQ, perceptual reasoning, and working memory in children 6 to 9. And there were associations that were noted between different genotypes, maternal genotypes, that supported a potential hypothesis that there might be a genetic link to susceptibility to environmental toxins. And then the next study that was used is the Center for Assessment of Mothers and Children, the Chamacos Study. Now, the Chamacos Study is an ongoing longitudinal birth cohort investigation of children in the farm worker community of Salinas, California, also in up in the Northern California region. There's multiple studies that have been published using this data, but in particular, what the EPA presented was a pooled analysis of 4 different studies that used the Chamacos. So they also used, in this pooled analysis, they also used the Mount Sinai study and the Columbia study, and then another study, the Cincinnati Children's Environmental Health Center home study. So again, the Mount Sinai, Columbia were urban. The home study was urban and suburban. And then the Chamacos was rural agricultural. So what they found, so the very big study, and what they found was only the Chamacos Center birth cohort reached statistical significance for an association between organophosphate exposure and the Mental Development Index. But they did find differences when analyzed by race ethnicity, with the Hispanic sample population to have the strongest negative association between chlorpyrifos exposure and MDI. So I want to go back to why do I have these in red. So again, I am reading these epidemiologic studies as a clinician, as a scholar, and I want to think, well, why isn't this data that is the summary, the clear summary can be that there is effect on neurodevelopment with chlorpyrifos exposure. So why isn't this a slam dunk? So some of the things that I read as a clinician is, well, okay, this first study, the Columbia Center for Children's Environmental Health, was done in 1998 with indoor exposure. Now, subsequent to that, indoor exposure has been banned because of what we understand about the potential effects on neurodevelopment. So I'm trying to relate this to, what does this mean for my patient's exposure now? So this was a heavy exposure prior to the residential ban. I will also just sort of chime in here at, the residential ban, and so it was in 2000. And I had all my 4 kids before 2000, and I so clearly remember my mom, we would be at the beach, and my mom would get a can of Raid and start to spray ants. And I was pregnant, and I was not thinking, oh my God, what is in that can? I can't be around something that comes out of a can. What I so clearly remember is every fiber in my body when she sprayed that Raid said, get out of there. So that body's protective mechanism. And I just remember telling my mom, don't do that. It makes me ill. So then, the next red, I'm thinking as a a clinician and a scholar, well, we're seeing slight decreases in full scale IQ, perceptual reasoning, and working memory. Now, not to minimize that any decrease is a good decrease. No decrease is a good decrease, obviously. But my clinician mind wants to know what is the clinical significance of these changes. Also, as a clinician and a scholar, I know that these are epidemiologic studies with associations. The associations are consistent and persuasive, but they are not cause and effect studies because we wouldn't put humans under the conditions to create a cause and effect. And then the next, my next critical analysis of the study, the pooled analysis, was there was significant heterogeneity. So why was there significant heterogeneity? Well, perhaps it had to do with the study design or other confounding factors. But the scholar in me notes that there was significant heterogeneity in the studies. So overall, though, as you read these studies, the summary is that there seems to be an association between, a consistent association between chlorpyrifos exposure and neurodevelopmental changes in children. So the first 2 studies I talked about were they were testing the sample they were testing was prenatal exposure. All of them actually were prenatal exposure because Chamacos was also prenatal exposure. So what progress has been made since up until now? There has been, as I talked about before, there has been a residential ban on chlorpyrifos. There was a tomato crop ban on chlorpyrifos. The use on chlorpyrifos, there was restricted use on apples to dormant application and pre-bloom. The tolerance has been lowered on some crops, limitations on citrus and nuts, limitations on agricultural application rates, and creation of no spray buffer zones. So some of the controversy, again, I, as a clinician, trying to understand the controversy, trying to be able to speak to my audience in District 1, what is some of the pushback against the reversal? So the EPA didn't go forward with a ban of chlorpyrifos, and then what was some of the pushback? And some of the considerations were, and again, Jay can certainly weigh in at the question and answer period, but that the EPA did not, in refusing to ban chlorpyrifos, did not appropriately calculate risks associated with potential genetic variability, that the EPA did not adequately address prenatal and early childhood safety factors, so those critical developmental periods that Jay spoke about, and that the EPA, in making its decision, was overly reliant on chemical company industrial data. So to go back to in 2017, when the decision came forward not to ban chlorpyrifos, it wasn't, according to the calendar for review, product review, it wasn't going to come up again. Chlorpyrifos was not going to come up again until 2022. Now, remember, this is 2017, so we're talking 5 years. Now 2022 is getting a little bit closer, but so a number of suits, including in District 9 in California, other states came forward to try to expedite consideration of chlorpyrifos before the next review date. So where did I land on all this, and how do I talk to my clients? There certainly is, a review of the available literature certainly suggests that it's reasonable to advise my patients that human epidemiologic investigations and mammalian toxicity studies support a potential link between organophosphate exposure and negative neurodevelopmental outcomes, particularly for vulnerable populations, including pregnant mothers, children younger than 2, and agricultural workers. And so, as an advocate, I align with the American Nurse Association and the American Public Health Association that using the precautionary principle that posits the absence of certainty, that appropriate course of action is to err on the side of caution. And ultimately, I come to it with a social justice perspective. And, my take home is for myself is if I was pregnant, if I had a child under 2, if I had my loved ones chose to be conventional farmers rather than organic farmers, that I would not want them to be exposed to chlorpyrifos. So then, how can I sit back and not and allow others who don't have the same choices that we have be exposed to chlorpyrifos? I will go back to also, Jay was talking about the social value of using some kind of pesticides. I will also say that having organic farmers, there is a bug in their soil that they can't get out. And it's making it hard for them to survive as small scale, sustainable farmers. They also will say that there doesn't seem to be, at this point in time, a good organic alternative to keeping worms out of their apples. But bottom line for me is that if I'm not willing to put my own family in that position, then I need to take an active stance in making sure others aren't exposed. So from a nursing perspective, what is our ANA code of ethics? That we have commitments to patients, individuals, families, groups, communities, and populations. And this is sort of one of my sticking points, is sometimes I hear, well, because you're an independent, you're a practicing nurse, you're not interested in population health. To me, that couldn't be farther from the truth. All of us as nurses are committed to population health. Yes, sometimes we could work on our awareness and our advocacy, but we are we have a commitment to the community and the population. That we have a commitment to advocate for the rights of the health and safety of patients, and that we have a commitment to collaborate with other health professionals and the public to protect human rights, and particularly to reduce health disparities. So what we do as nurses is we educate and we advocate as well as care. So next steps in California was California EPA has recently come out, I believe this is May 2019, and they are moving forward with a chlorpyrifos ban. And what I think is wonderful in this, from my perspective of caring for my organic sons and my conventional farmer legislators, is that there is a promise to invest $5.7 million in new funding to support the transition to safer, more sustainable alternatives. However, moving forward, it's going to take 2 years for this to move forward. So what do we do in the meantime in our agricultural communities in speaking to our patients and our community members? So some ways that we can have risk reduction in terms of pesticide exposure is to be sure our patients know to avoid spray exposure. And if they cannot get out of the line of fire, close the windows, turn off the air conditioner. And, you know, if you're in a critical developmental period, potentially wear a respirator. If you're pregnant, I would consider wearing a respirator. Children should not play outside during agricultural spray times. They shouldn't play in agricultural fields. They shouldn't play around drainage ditches. And their play equipment should be covered if they're in the line of spray, and then cleaned regularly. Workers should wear worker protective equipment. They should not eat in the fields around any types of sprayed pesticide. When they come home, they should shower immediately, wash their clothes separately, consider a no shoes policy in the home, and walk off mats to try to leave any residue outside the front door. Should advocate for frequent house cleaning and frequent hand washing. And then in terms of our own consumption, and this is, again, going back to much of my learning has been beyond reading the EPA reports, has been sitting around the kitchen table talking, to my sons who've studied the issue and are serious farmers. We talked about buying organic, and buying organic is great, but buying organic can be extremely expensive. And really what hit home most to me in talking to one of my sons is he said his stance philosophically is you don't buy organic for your own personal health. You buy organic for the health of the farm worker and then the health of the planet. And I've used that line many times over because that resonated with me as a community member and a mom, and it resonates with others. And then in terms of your own health and well-being, if you can't buy everything organic, certainly try to choose the things that might have the highest risk of pesticide residue. And so the Environmental Working Group has the Dirty Dozen there, and you can look that up online. And other recommendations are to wash produce in a 1% baking soda solution. And then if that's for non-systemic pesticides, and then to get rid of systemic pesticides, you can peel the fruit, but of course then you're balancing with the loss of the nutrients. So I just want to say thanks for allowing me to chime in here as a community member and a clinician. I am happy to continue this conversation. Much of what was presented here is in the Journal of American Association of Nurse Practitioner article that Dr. Sattler and I put together. I'm happy there's much more information in there, and I'm happy to send you a copy of that. And then from me and my organic boys, I will be spending 4th of July picking blueberries. We thank you for your interest.
So thank you. We want to offer a special thanks to Jay and Alexa for joining us today and offering their expertise in this area. Be sure to join us next month on Monday, August 5th, 12 p.m. Pacific Standard Time, 3 p.m. Eastern Standard Time for a discussion of modern and sustainable agriculture. I'd like to give Barbara an opportunity to say hello, and then after that we'll answer questions. If you want to ask a question to one of our presenters, just write that question in the attendee chat on the left side of your screen. Right now we don't have any, so we'll have Barbara have a minute here.
Yeah, so thank you. Those were fabulous, really fabulous presentations. And I think that probably there are a number of questions, and I do want to recognize that also a number of people probably will have to go offline now because we're after the hour. I want folks to know that the Alliance of Nurses for Healthy Environments has a policy and advocacy work group, and that is the work that meets once a month to talk about critical issues. And chemical policies is one of our noteworthy policy areas that we work on. So if any of you are interested in continuing conversations about that, please feel free to join that work group. Also, we're formulating a food and agriculture work group. If you have interest in that, please let us know. And with that, let's see if there are any questions. And we do understand if you have to get off the line, but I think I'll just ask Jay and Alexa to stay on for a moment in case we do have any questions from the audience. And are you seeing any?
I'm not seeing any questions, but presenters have their emails attached to these slide decks, and we will have a recording of the webinar that we will post on the Annie website. So if a question comes up later, you can certainly ask it, or just email me and I will point you in the right direction and get the answer for you. Actually, and we did have a question about emails, which I'll get back to on my own. Okay, thank you very much, everyone.
Thank you very much. Take care.